Hello and welcome. Today we are going to be talking about the mouth body connection. Let's dive in and get to it. So, you are going to learn a few things. First, I want to share with you the one thing about my health I've learned over the past year that has literally changed my life. Also, the hidden impact that it has had and is having on my body, and why I am traveling 1,764 miles to fix it. Quick disclaimer here: I am a nutritional therapy practitioner, or NTP is the acronym for that. I am not licensed or certified by any state. So the content that I'm sharing with you today is strictly for entertainment purposes only. It is not medical advice and should not be treated as such. If you want to read this disclaimer in full, you are welcome to pause the video and do so. But as I just said, I am a nutritional therapy practitioner. My name is Whitney Marks. NTP is the acronym for my certification. I am currently a health coach, and I have coached hundreds of clients, hundreds and hundreds of clinical hours under a very well-known and prominent doctor in the holistic health and wellness space. He's a phenomenal pioneer, and I've learned and have coached many clients, and the content that I'm sharing with you today under him. Why this matters: this could potentially be secretly affecting every aspect of my health. The more I learn about it, the more that I'm really just excited to dive deeper into my own health and well-being, to learn even more about the possibility of how well I can actually feel. And this really leads to the whole concept of innate intelligence, which is your body is designed to heal itself. And this is a principle that I coach all of my clients on. And it essentially means that we were hardwired from birth for our bodies to know what to do to heal itself if there's an issue or a challenge or a complication. It knows what to do if we just give it the right environment to do that in. And if you think about a cut or a scrape on your body, let's say maybe when you were a child, you fell and you scraped your knee on the ground and you eventually got a scab, right? There was a wound, and then it scabbed over, and then over time, in the coming days and weeks, it fully healed. Maybe it left a little scar behind, but then over time, maybe now the scar is barely noticeable. Well, we didn't have to tell your body to scab. We didn't have to tell it to heal over the course of the days and weeks, right? Like, there was nothing that you had to do to get the body to activate that healing process. Now, there are certainly things that you can do, right? Maybe your mom put some sort of spray on there, alcohol, whatnot, right, to kind of kill the germs. So yes, maybe there are some supportive mechanisms in place, but ultimately, at the end of the day, your body activated the healing processes that are innately built in, and it knew what to do to heal that cut or scrape that you had. So really, that's the foundation of a lot of what again, kind of the baseline of what I want to share with you today. So let's dive in and talk about this mouth-body connection. And what I'm going to specifically chat with you about today is a cavitation. So what is that? It may be a term that you are totally unfamiliar with. At one point in time, I was as well. Essentially, what this is again, a hole in the bone, usually where a tooth has been removed and the bone hasn't healed back properly. It is an area of dead bone that has a spongy-like quality of very low bone density. And this is the definition from Dr. Scott Chandler, who is the dentist at Summit View Biological Dentistry and Wellness out of Park City, Utah. How do cavitations form? Well, there are two primary ways that cavitations form in your mouth. The most common way is from an extraction, and For whatever reason, here in America specifically, wisdom teeth are among the most commonly extracted teeth, usually when we're teenagers. This was the case for me when I was around the age of 16, 17, late high school years. I had all four of my wisdom teeth out, and most American teenagers do have that, do have their wisdom teeth removed. So this is one way that you can begin to think through the possibility of cavitation. So for me specifically, I had my wisdom teeth extracted, and there is a high likelihood that if that's been the case, that so a high likelihood that with any extraction, but specifically with wisdom teeth, that a cavitation could be present. And the second most likely way that a cavitation can form is from a physical injury. So along the lines of an auto accident. So, those are obviously pretty common, even sports injuries, etc. So any injury to the head or the neck area can result in a cavitation as well. And so let's really dive in and explore why cavitations are a problem. So one of the most common themes that I see with many of my clients is this journey that they have been on, and I include myself in this, is that there's a particular area of my own health or areas that I just feel like I haven't conquered, and I haven't reached the optimum health that I know my body is capable of. Again, if we go back to this idea of innate intelligence, I still don't have the energy that I would like to have and that I know is possible. Some days I feel like I have it. Other days I'm really struggling with that. And there are some other areas of my health as well that I don't feel like I've yet just really conquered or mastered. And so I see this with my clients all the time as well. And for many of them, they have really been on this journey of really trying to figure out why they don't feel well, but not really knowing the answer. And so maybe that's been the case for you. You've seen everyone, you've tried everything. The supplements haven't worked. The lab results may even come back normal, and someone may have told you that you're fine because your lab results are normal, but you know your body best, and you know that you don't feel well, that something is still off, or that you just don't feel right. And cavitations are sneaky because they are essentially a hidden infection in your jawline. And they are sneaky because they go undetected by the body's immune system. So unless you really test to see if cavitations are present, you'll never know that it's there. And I'm going to go into how to test and just, again, kind of navigating this process, but wanted to speak to why this is really a problem in the first place. So it's really different than an abscess infection. So many times with the most common tooth infection, like an abscess, it will feel painful and we'll know that something is off or wrong. But the reason why cavitations are, again, such a big problem is because they're hidden. It's going undetected by your body's immune system. So you don't know that it's there unless you test and you know that it's there. The other tricky part with cavitations is that symptoms from cavitations and having usually our wisdom teeth pulled, the symptoms from that process don't start until 20 to 25 years after the extraction has taken place. So it's really hard when you're around 40 or 45 years old to connect the dots to having your wisdom teeth pulled, as an example, to present day and why you may not feel well. And this is around the timeline that I had my wisdom teeth pulled as well. So I'm around the 20-year mark. And another reason why I am passionate about this topic of health is because cavitations affect the central nervous system of the body. And that includes anxiety, depression, and a whole host of other imbalances that can come with our central nervous system not being in balance or homeostasis. And to some degree, many of us have had anxiety or have anxiety and or depression. And so because this is such a common epidemic, most of us don't even know that the reason that we could be wrestling so much with anxiety actually goes and points to a physical challenge that is happening in the body. Let's talk about what's inside a cavitation, right? So we know there's a hole or a space in that jawline. There's hidden infection that could be there. So common things that are inside of a cavitation include anaerobic bacteria, deviant cells, pathogens like parasites or their eggs, and mercury reservoirs. Sometimes let me back up and just say that the reason that we know what's inside of these hidden spaces in the jawline is because you can test. There is an actual pathology report that can be ran by a dentist who is performing a cavitation procedure to get rid of cavitations. Now, not every dentist will do this. Only certain dentists will provide this as an additional service. But pathology reports reveal, so that kind of the science and the data tell us what's inside. And I have a sample here of a pathology report and a couple of there's a bunch of Latin names here, but a couple that I wanted to point out include parasites, as I mentioned earlier, can hide in these spaces, as can H. pylori. And this is a very common bacteria that can live in the gut and really keep the gut inflamed. So this is just an example of some of the things that can be hidden in cavitations. And if these things are present in your body, then it only makes sense that they get removed so that the body can then further heal, thus allowing you to feel better. One really helpful tool that I have used to help me identify some of my own health challenges and how that could be connected to cavitations that I know that I have, as of the date of this recording anyway, is called the tooth meridian chart. Feel free to drop me a comment in the description or the comment area below. By the way, if you're familiar with a tooth meridian chart, if you know what this is, or maybe you don't know what it is and this is your first time hearing about it. So would love to just get some feedback from you on that. But essentially what it is a visual aid that maps out the connection between each tooth and an acupuncture meridian, or also known as like an energy highway that runs through the body, that's connected to various organs, tissues, glands, and depending on what tooth could have an associated cavitation with it, can give you a really good depiction of the other area or areas of the body that could be struggling. And this can be anything from metabolism and weight loss resistance to thyroid dysfunction to cardiovascular challenges. So this can be a really helpful tool. And you could do a Google search if you wanted to dive in a little bit more on actually exploring a tooth meridian chart. Or if you would like for me to share one with you, and maybe in the description of the video, feel free to leave me a comment on that as well. So now that we know really what cavitations are and why there could be a challenge, let's look at what to do about them. I mentioned earlier that you can test, and that really is step one. As of today, there's only one test that can accurately depict cavitations. The name of the test is called a cone beam scan. The technical term is called a CBCT scan, and it stands for cone beam computed tomography. And it's a type of x-ray that produces 3D images of not just the teeth, but also your bones, soft tissues, your sinus cavities, your nerve pathways. And it's really important to find a dentist that has the scan, but also the software to read the scan. Now, the average dentist is not going to have a cone beam scan. So it really takes a specific kind of dentist, usually a biological dentist. That's what they can sometimes be called, that has a cone beam scan in their office. And if you are unfamiliar with this type of dentist or how to go about finding a dentist with a cone beam scan, I have listed off some websites here that can be helpful in getting started with finding a dentist who has this type of scan available in their office. Generally, the scan is a few $100s. And really what you're looking for, again, is a dentist who has the imaging technology available, so the scan, as well as the software to read it. And so what I mean by the software to read it is a specific software that measures and tells the dentist what your bone density is at any given place in your jawline, because that's really what needs to be read and understood in order to accurately depict whether or not a cavitation is present. It is not enough to just visually look at the results of a cone beam scan at the 3D x-ray images to see if there are holes or spaces in the jawline. That's not enough. And oftentimes dentists, even though they may have the scan, they don't even know that there's more to it than actually needing to read the bone density levels. So it's really important to find a dentist who has the right software to read those bone density levels. Again, here are some really great websites that can help you find a dentist with a cone beam or CBCT scan. In some cities and parts of the United States, mobile clinics, so this is not even a dentist office, this is more of a technology clinic or a radiology clinic kind of on wheels that will have the scan available. And so you could do a Google search for mobile CBCT scan near me, or you could type in a specific city or area for a CBCT scan, Google search, and the terms for biological dentist CBCT scan near me. All of that can be helpful. Now, in the clients that I have helped and in my own journey, I have found this to be the case, that sometimes if you find a dental website, it's not enough to just look at the website and see if they talk about a cone beam or CBCT scan on their website. For whatever reason, and this was the case with my dentist, he doesn't promote that he has a cone beam scan in his office. So usually what I'll recommend is, if you find some dentists in your area or some that are within a reasonable driving distance that pull up on any of your search results and their website doesn't talk about a cone beam scan, do some extra due diligence and just call or email their office to see if they offer it. Because again, many dental practices have the testing and the technology available, but they're not actively promoting it. I think part of that goes back to most people aren't familiar with this type of scan, or they're not familiar with cavitations. And so to put it on there, it's just, again, not probably the number one service that most patients are looking for as they are trying to find a dentist. So just do some extra due diligence and start calling around if you need to. And then if the software and the scan results really come back that there are cavitations present, and this was the case for me. So I had my cone beam scan done, and my dentist actually said there were no cavitations because he only looked at the visual. He didn't have the right software to accurately detect my bone density level. So I had to send my scan off to another dentist who virtually had a consult with me and did have the right software. And so that was kind of my journey. And it came back that I have 4 cavitations where my wisdom teeth were pulled way back when in my later teen years. So now the next step that I'm currently about to go through is having the procedure done. That's a minor procedure. A minor procedure. It's a cavitation surgery where the dentist goes in. They open up the space where my wisdom teeth previously were, and they clean out the hidden infection that's there. So the modalities or the tools that are ideal for a dentist to have when they are doing cavitation surgery is laser, ozone, and PRF or PRP. This stands for platelet-rich fibrin. And bone grafting is also usually strongly encouraged with more severe cavitations. Bone grafting really helps foster bone regrowth and healing, as do all of these modalities. Without them, you really run a higher risk of cavitations reforming or not really healing back well, and then you're still stuck with the same cavitations that you had before if these supportive therapies are not used during cavitation surgery. So for me, I have found and located a dentist that is 1,764 miles away from where I live, and he uses all of these therapies and then some. His success rate with cavitation surgery is 99%, and he has assured me that there's really about a 1% chance that they could come back. And so with that, I am willing to travel that far to be sure that the right dentist does the right job so that it's kind of a one and done and that my body can heal and my health can continue to improve. Again, you can use these websites to help you find a dentist who does cavitation surgery as well. What I like to say here is, again, many of these dentists don't actively promote on their websites that they do cavitation surgery. So for me, it's a matter of usually having to call or email a dental practice and really do some extra homework or legwork to vet dentists out. Do they do cavitation surgery, and what therapies are used during the process? For more info on cavitations and doing a little bit of a deeper dive on the topic, here are some resources that have been super helpful for me in navigating this as part of my journey. So Root Cause is a movie. It's definitely on YouTube. I believe it's also on Venmo. You can rent and some other platforms as well. It explores root canals and cavitation specifically. It's a pretty entertaining documentary. Hidden Epidemic is a book by Dr. Thomas Levy that's also fantastic at doing a deeper dive and building some extra knowledge around the topic. Dr. Daniel Pompa is a fantastic forerunner in the industry who is actively educating people on this topic. He has a YouTube channel and a program called the Pompa Program. And Summit View Biological Dentistry and Wellness. This is Dr. Scott Chandler out of Park City, Utah. And he is also a wonderful pioneer in the dental industry, really laying the groundwork and getting this message out to even other dentists, even holistic and biological dentists in the industry as well. So I hope this information was helpful for you. Drop again, a comment below. Let me know if you learned something new, if you would like to hear more on this topic. Thank you so much for tuning in, and we'll see you on the next one.